Hello and welcome everyone to this channel. Today we'll be learning about the different forms of rhinitis. So first topic we'll be learning about atrophic rhinitis. Then we'll be learning about vasomotor rhinitis, rhinitis caseosa, rhinitis sicca, okay, and vasomotor rhinitis. And I will also give you a brief account of allergic rhinitis, and we will end this topic, okay. So this video will be slightly long, but we will complete each and every aspect of this disease, okay. Atrophic rhinitis means, remember, the nasal mucosa and the turbinates are being atrophied. That is why this is known as atrophic rhinitis, okay. The first stage of rhinoscleroma. Rhinoscleroma is actually a disease of your, it's a granulomatous disease which is caused by Klebsiella rhinoscleromatis. Okay, so in Klebsiella rhinoscleroma, okay, in rhinoscleroma, the first stage, it resembles atrophic rhinitis. Okay, now you have understood this much. Now you need to understand that why will even we have atrophic rhinitis, and who will actually have atrophic rhinitis? Is it either it is males or either it is females will have atrophic rhinitis. Okay, so most commonly it is seen in females. Okay, young females, atrophic rhinitis is much more common. Okay, and we tend to remember it with the mnemonics of hernia, hernia, hernia. Hereditary factors of autosomal dominance. Maximum possibility is autosomal dominant. Okay, E is for endocrinal factors, R is for racial factors, more common to Americans, okay. N for nutritional factors, vitamin D deficiency, calcium deficiency can lead to this one, okay. And also iron deficiency, anemia, okay. Also autoimmune condition. And I stands for infection. Infection by which organism? Infection by Klebsiella oziene. This is the organism leading to atrophic rhinitis. So I hope you are clear till here. Now let's start the slides. I will be going rapidly, very easily. This is a revision work, okay. So remember, chronic infection, chronic infective sinusitis, specific, non-specific. Atrophic rhinitis, remember, you need to remember three important things. One is factor, other one is crusting, other one is atrophy of the nasal structures. Nasal structures atrophy means atrophy of the nasal mucosa, atrophy of the turbinates, atrophy of the mucin producing glands, because of which whole of the air will be a roomy cavity. It will be an enlarged roomy cavity. And what happens is, whenever you intake in the air, initial 2 to 3 days there will be no obstruction, all the airs will go inside, no humidification function, no temperature regulation function, it will all go inside. And after 2 to 3 days, 4 days, there will be all crust, and because of all formation of crust, there will be a bilateral nasal obstruction. So the patient presents with bilateral nasal obstruction. Let me give you a case history of atrophic rhinitis. A 35-year-old menstruating female comes to the department of ENT with a history of severe tetany sometimes, and now her nose is full of crust. What is your diagnosis? Severe tetany means there's a calcium, there's a vitamin D deficiency. She is a female, menstruating female. This is more commonly, this is atrophic rhinitis. Now let's talk about the chronic inflammation of nose with progressive atrophy of the nasal mucosa and the turbinate bones, formation of scanty viscous secretion. Why scanty? Because all the mucin producing cells has been atrophied, okay. And green crust, there's formation of green crust. Now in the following slides I will also show you the diagram of the crust, how does it look like, okay. And it emits a foul odor. This foul odor is actually not perceived by the person himself, not perceived by the female herself, but it is perceived by someone else. That is why this is known as merciful anosmia. Remember, all the crust must be removed, and the crusts are removed by nasal douching. Nasal douching can be done by sodium bicarbonate, sodium borate, and sodium chloride, whereas the quantity of sodium chloride is more, okay. This three is mixed in the normal saline and it is used in a nasal douching pattern, okay. We will come to that in the treatment phenomena. One is primary, other one is secondary. Primary, remember the mnemonics of hernia, hernia. Developmental anomaly, someone can have a highly enlarged nasal cavity, okay, but their turbinates, their mucosa is all same. It's just that the cavity is enlarged, because of which atrophic rhinitis becomes more common in those individuals. Hereditary, endocrinal factors, racial, endocrinal, it is high during the menses period. It is associated with high amount of estrogen. Now Nutritional deficiency, as I have already told you, infection by Klebsiella oziene. Autoimmune conditions, different autoimmune conditions can lead to atrophic rhinitis. Surfactant deficiency in the nasal mucosa. The nasal mucosa, it consists of mucus producing glands. There is atrophy. Now sometimes there might be a surfactant deficient in the nasal secretion leading to atrophic rhinitis. Congenital spacious nasal cavity, as I already discussed in the developmental pattern. Hereditary maximum is the dominant pattern, already said in the first slide. Endocrine pattern, most commonly in puberty. Menstruating females, okay. Menopause, it's written menopause, but it's more common to the menstruating female, okay. Symptoms aggravated due to estrogen deficiency. Remember, estrogen is the role factor, its deficiency leads to this one, okay. And remember, whenever we talk about therapy of atrophic rhinitis, sometimes we also give estrogen. It helps in vasodilation and helps to keep the nasal mucosa patent. Estrogen therapy, placental extract, nasal douching solution, glucose in glycerol, and of course chemicitin. We will learn about that certainly. More common in Americans, Negroes, and Latin. Nutritional deficiency, vitamin E deficiency, vitamin D deficiency, Klebsiella oziene, diphtheroids, Haemophilus influenza, Coccobacillus, all explained well. Autoimmune viral infection, malnutrition, and immune deficiency can trigger destruction of the autoimmune, can lead to destructive processes. Autoimmune condition, HERNIA, hernia. Do not forget. I think I have said this hernia. This is the third time. If you forget it, then that's your problem now. Please do not forget hernia. Remember, autonomic imbalance. Autonomic imbalance reflects sympathetic dystrophy syndrome and surfactant deficiency in the nasal secretions, okay. And remember, secondary atrophic rhinitis is caused by, basically it is caused by granulomatous disease like leprosy, syphilis, and tuberculosis. Very good. And remember, rhinoscleroma can also cause rhinoatrophic rhinitis, and also deviated nasal septum. Deviated nasal septum can also lead to secondary atrophic rhinitis. So what are the symptoms? There'll be nasal obstruction, greenish yellow discharge, bilateral nasal obstruction, greenish yellow discharge, merciful anosmia. Because of the crust, there is no basically aeration of the sinuses, that will lead to recurrent sinusitis may be present, okay. Number 5, it can lead to headache, facial tenderness, all the features of sinusitis, okay. And of course the patient compliance will be very low. No one will to come in the patient's near. For example, a girlfriend is having a merciful anosmia, atrophic rhinitis. Her boyfriend will not want to kiss her. Why? Because of the excessive foul odor. And you know one thing, the girlfriend will not know that I am having foul odor until and unless her boyfriend says that you are having so much of foul odor. And if the boyfriend says that, girlfriend will slap him. See, so much difficult condition. If you say also, she will slap. If you will not say also, she will have this merciful anosmia. Signs: roomy nasal cavity with atrophy of the mucosa and turbinates, greenish yellow discharge, foul smell, nasal septum perforation. Of course, this crust can cause perforation. Remember, nasal septum perforation, most common cause is actually septal abscess, septal hematoma leading to septal abscess and cause nasal perforation. Nasal septal perforation can also be caused because of yes, foreign body, impacted foreign body. It can be caused because of rhinolith. It can also be caused because of certain diseases like Weber's granulomatosis, syphilis, okay. Nasal myiasis can be there. Nasal myiasis means basically all those maggots can be actually infiltrated in this one. Why they will infiltrate? Because there is a pungent odor is there, okay, and they love those odor. Myiasis love those odor, and more eggs will come from here. There'll be formication in the case of nasal myiasis, okay. And in severe cases, it can lead to nasal perforation also. Lot of problem. Nasal crusting, see greenish yellow discharge, you can see more clear in this picture. So this is the normal turbinate and the meatus. Now you can see the turbinate atrophy and the roomy nasal cavity, but soon they'll be filling with pus, all with secretions, and all with your crust. DT for oziene, DD for dry nose, okay. I don't need to explain this, I think. Causes of anosmia, causes of nasal obstruction. Please look into this thing. It's self-explanatory, okay. No need to explain much. This is important. Biopsy finding. Can you see the epithelial line cells over here? Here there is no epithelium. All the glandular tissues has been already atrophied. No glandular tissues. Where will the mucus come from? Okay. specific investigation, you can go for saccharine test, you can go for x-ray PNS, you can go for CT scan, you can go for nasal endoscopy, you can go for just an examination to the of the turbinates like this. Okay, just go for Bull's lamp examination. Just open here and just look into the vestibule, and then use the thudicum and open it and look into the inside the nasal cavity. Okay, and iron and protein level, because we know that malnutrition has been a cause. Just rule out all the causes. I told you one was malnutrition, one was being a female, estrogen, lack of estrogen, and you need to also rule out certain factors like autoimmunity, syphilis, leprosy. You can go for VDRL test, chest x-ray, you can go for a Mantox test. Okay, Mantox test, CT scan can be done, because of the atrophy of the nasal ciliary epithelium that will lead to defective mucociliary clearance. So you have to go for saccharine test. Okay, that is why we are going for saccharine test. Okay, and all the maxillary sinus will be filled with fluid. Maxillary sinusitis might be there. This is all self-explanatory. It is all said. Okay, now medical treatment, you can go for nasal douching solution. I already told you the components of douching: sodium bicarbonate, sodium bicarborate, and sodium chloride. It is mixed with 280 ml of warm water to make the solution, and then you just nasal douche it. Okay, estradiol nasal spray can be used for vasodilatory purpose. Okay, vasodilation. And what you need to remember is glucose in glycerin is very, very important drug that we can give. We can also give placental extract. We can also give rifampin, chemicitin. Chemicitin, remember, with the mnemonic CDE. C means chloramphenicol, D means vitamin D, E means estradiol. Very good. So there's a combination, estrogen, vitamin D, and chloramphenicol. Combination is there. Never miss cimetidine, placental extract, glucose in glycerin, estradiol, and nasal douching. Okay, others like streptomycin injection you can give, because streptomycin was also used in the case of your rhinoscleroma. Okay, so streptomycin injection you can give. You can give potassium iodide orally, you can give, right, disinfectant. Now, action of the placental extract: it has progesterone, helps in hyperplasia of the nasal mucosa. Estrogen helps in vasodilation, right? Now, that was major important. Surgical treatment, you can go for either Young's operation, or you can go for modified Young's operation, or you can go for Lost and Lager's operation, or you can go for submucosal Teflon and fat insertion. Okay, so what you need to remember is Young's operation is basically you just lift off the periosteum all over, and then you just close the nasal cavity. Okay, you close the bilateral nasal cavity. Okay, in the case of Young's operation. Okay, sorry, in the case of Young operation, first you'll close one nasal cavity, and then after certain months you'll open this nasal cavity, you'll close this nasal cavity. Okay, and this takes a lot of time. You need to give basically we are doing this Young's operation so that we want the nasal mucosa, inside the nasal mucosa, to regrow, right? In the case of modified Young's operation, what you do is you just leave a 2 to 3 mm of opening left over in the vestibule, so that from that you can go for a fiber optic scan. You can go for glucose in glycerin insertion. Okay, so that will come in the slide. See, Young's operation, only only one nostril is closed completely by raising two circumferential flap, inner and outer cutaneous, in the nasal vestibule, suturing them in the midline. Excellent. See here. From here, I will lift up the nasal fold and I'll just cover it like this. See? Easy? Okay. Modified Young's operation, we will keep a 3 mm of opening. Okay, and then what we'll do is we will just keep that 3 mm opening, and both the nasal mucosa is done at the same time. Okay, done by similar way, but keep a 3 mm opening on both sides, done for both sides. Okay, and cutaneous mucosal flaps here, all covered. In the case, this is done in the case of Young's. Okay, Young's. Okay, healed flaps. Okay, in this way it's totally healed. Okay, and after that only you'll do this one. But in modified Young's, both you will close, but you'll keep a small opening over here. Modified Young's, see a small opening you have kept here. From here you can go for a fiber optic scan. You can go for a glucose and glycerin insertion. Okay, progressive can be monitored with a 2.7 mm of nasal endoscope. Glucose and glycerin drops can be installed. Both nostrils are operated at one sitting. In Young's operation, first this one, then that one. Okay, so in modified Young's, it's just one sitting, right? Nasal breathing is preserved. Okay, and no complaints of denasal voice, because if the nasal cavity is blocked, there might be a rhinolilia clausa, so that will not be the problem. Better cosmetic results in the case of this one. Okay, submucosal Teflon paste can be, submucosal Teflon and submucosal flat can be inserted. Okay, and sublabial implants can be done. So you can see here And now let's come to rhinitis sicca. So what is rhinitis sicca? Rhinitis sicca means, basically sicca means dryness. Okay, so rhinitis sicca means basically what will happen is there will be dryness. Okay, rhinitic caseosa means there is a blockage of the sinuses, and because of which cheesy material is now present inside the sinuses. Okay, now rhinitis sicca, it's a mild form of atrophic rhinitis seen in hot, dry, dusty places. Okay, hot, dry and dusty places. Bakers and Goldsmith, alcoholics and anemics. Okay, alcoholics and anemics. Okay, hot, dry, dusty places, okay, and alcoholics and anemics. Okay, crusting present anteriorly only. Why anteriorly? Because this rhinitis sicca is more common to bakers, bakers. Why bakers? Because whenever they just open the oven, for example, this is the oven over here, and I just open the oven, sudden gush of hot air inserts into my anterior part of the nose, right? So it really becomes dry. Okay, and sometimes the bone atrophy and the fetor is absent. Okay, crusting is only present on the anterior side. Okay, nasal touching can be done, and change of the surrounding. Just go for a humid surrounding. Do not just go for a hot climate. Okay, and it's a mild form of atrophic rhinitis. Now rhinitis caseosa means it is also known as nasal cholesteatoma. Question may come, write short notes on nasal cholesteatoma. Now you might be confused. Nasal cholesteatoma, what is this term? I'm shocked, I'm depressed, because the question has not been said till now. Nasal caseosa, nasal cholesteatoma. I'm giving some more time for this one, because I want you to remember it right now. Nasal cholesteatoma means rhinitis caseosa. It's a chronic inflammation with deposition of foul-smelling cheesy material in the nasal cavity, nasal obstruction, stasis of secretion, exfoliated cells, putrefaction, caseation, removal of the cheesy debris, and correction of the nasal obstruction. So here it's said that the nasal cavity is full with cheesy material, but in a book it's also written that the cheesy material can extend to the sinuses, and that will lead to recurrent sinusitis. Okay, it is also known as nasal cholesteatoma. It's a chronic inflammation with deposition of foul smelling cheesy material in the nasal cavity. So what will have, you'll have foul smelling cheesy material in the nasal cavity. Okay, there'll be nasal obstruction, stasis of secretion will be there, exfoliation of the cells will be there, putrefaction will be there, caseation will be there. Foul smelling cheesy material inside the nasal cavity also extending towards the sinuses is known as rhinitis caseosa. Now what do you mean by vasomotor rhinitis? Vasomotor rhinitis means, remember, vasomotor rhinitis means, whenever you talk about vasomotor rhinitis, you need to understand that what are we actually talking about. See, there are two basic response. One is parasympathetic response and other one is sympathetic response. Okay, during the parasympathetic response, what happens is the mucosa will be really boggy and there will be excessive secretions. But in the case of sympathetic response, there will be like a case of atrophic rhinitis. Okay, really a lot of mucus secretion during the parasympathetic phase, and the person will have bilateral nasal obstruction, and there'll be actually the compliance of the patient will worsen in the case of vasomotor rhinitis. Vasomotor means it is associated with the your autonomic system. Okay, autonomic system, it is associated with the autonomic system, autonomic imbalance. It is not like allergic rhinitis, or it is not like seasonal allergy. It is present throughout the whole year. Okay, every time, vasomotor rhinitis. And remember, the treatment for this will be partial turbinectomy, and if in case nothing helps, at the end of the day, what you need to do, you have to go for median nerve neurectomy, and that median nerve neurectomy, you will go from the transseptal approach. Okay, so autonomic innervation of the nose, I told from here also, autonomic, I altered the word autonomic innervation of the nose, deep petrosal nerve plus greater superficial petrosal nerve. Deep petrosal nerve is a sympathetic, greater superficial petrosal nerve is known as parasympathetic. Remember, the parasympathetic, the word is also so large. Deep superficial petrosal nerve, here deep petrosal nerve, simple. sorry, greater superficial petrosal nerve 1, parasympathetic, and deep petrosal nerve, median nerve. Okay, pterygopalatine ganglion, nasal glands. Sympathetic stimulation, there will be vasoconstriction and decrease in the nasal secretion. There will be vasoconstriction and decrease in the nasal secretion. But whenever there is a parasympathetic stimulation, there will be vasodilation and increase in the nasal secretion. Vasodilation to what? Vasodilation, suppose this is a mucosal gland, you supplied a lot of blood to this one, so it will release so much of mucus, right? So parasympathetic stimulation means vasodilation and increase in nasal secretion. Okay, deep petrosal nerve and greater superficial petrosal nerve, both are actually the petrosal nerves. Okay, so if it's greater, then it's a parasympathetic. Now, caused by overactivity of the parasympathetic nervous system, majorly parasympathetic. I told you in the first also. Okay, there will be nasal congestion, nasal block, and watery rhinorrhea. Nasal congestion is due to nasal vasodilation, and nasal block is due to nasal vasodilation. This is again due to nasal vasodilation, and watery rhinorrhea is due to increase in the nasal secretion. Okay. Now, triggering factor is emotional stress. Why emotional stress? Because whenever you are in emotions, what do you want to do? You cry. When you cry, what happens? So much of mucous gland is being stimulated. That is why you get so much of sneezing, so much of nasal discharge, and you know that all the secretion, it goes and it opens via the valve of Hasner in the inferior meatus, right? And there's a stimulation, sudden change in temperature, humidity, blast of cold air, dust, smoking, traffic fumes. Okay, all the things. But the major one you should not forget is emotional factor, air change. Okay, change in temperature. See, this change in temperature you can make into 4 points. One is humidity, cold air, dust, smoking. All change in temperature, right? So major is the change in temperature and the emotional stress. Clinical feature, you'll have nasal block, you'll have profuse watery rhinorrhea, paroxysmal early morning sneezing. Do not confuse with allergic rhinitis. Allergic rhinitis, whole sneezing and sneezing, all sneezing. Along with that, there will be allergic sinus and diarrhea sign in the case of allergic rhinitis. Along with that, there will be conjunctival. In the conjunctival area, you can also see cobblestone appearance. Okay, basically lymphoid infiltration, post-nasal drips, turbinous congestion, and hypertrophy. So you can go for a diagnostic nasal endoscopy, and you can see that the congested nasal mucosa. Treatment of vasomotor rhinitis. Yes, what you need to do is you have to sleep with head and elevated by 30 degrees. This is all the conservative methods, right? Sleep, work in cool environment, not cold. Cool means medium temperature. Okay, not very very hot, not very very cold. Okay. And keep your body warm. Okay, and regular exercise to perform improve in the vasomotor tone. Avoid of triggering factors like smoke, dust, fumes. Please avoid this in the case of vasomotor rhinitis. I already told you, humidity, blast of cold air, dust, smoking, traffic fumes, change in temperature, emotional stress. Please don't be emotionally too much stressed. Now, how are you going to go for medical treatment? First, you'll go for a ipratropium bromide spray, right? Ipratropium bromide spray. And there's anticholinergics, right? So, and what you do is you are having parasympathetic reaction. So, give drugs which are actually, they are anti-parasympathetic. So, that is basically anticholinergics, isn't it? So, ipratropium bromide spray can be given. You can also